224-5422. That's AMP2.TV. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, and thank you for joining us. This is You and Your Doctor. I'm your host, Melissa Santiago. And today we have a very special guest, orthopedic surgeon, Dr. Manish Gupta.
Well, thank you.
Thank you for joining us tonight.
I jumped the gun there a little bit. No, thank you for having me.
It's all right.
I love being on a show like this to help educate our community. And again, it's my privilege.
Wonderful. I'm so glad to have you here. I heard you were a Florida native.
Well, as a native as a Floridian can be. So, the way I say that is that I think you'll find very few people are born in Florida. Mm-hmm. There are, some, but I've been here since I was about 11 years old.
Okay.
And, I was born in another country, India.
Okay.
But I've been basically raised here in South Florida. So,
I would say from 11, you're a Florida native.
Yeah, it's more than
Absolutely.
30 years of my life. I don't want to give my exact age away, but we're good.
I wouldn't have guessed, so you're good. So, I wanted to talk about orthopedic surgery and kind of what you specialize in exactly, because I know there's so many different aspects of orthopedics.
Well, first of all, orthopedics is the study and the practice of the musculoskeletal system, right? So we take care of, injuries to the muscle, the bones, ligaments, and anything associated with that system. There are other systems in the body like cardiac, pulmonary. So that study, is where orthopedics specializes in.
Okay.
And then in that area, we get to specialize in certain parts of the body, like the shoulder, hips, knees, whether it's spine, hand. And, as an orthopedic surgeon, I'm trained in all of them as part of my residency, but I've chose to focus in the area of sports medicine. So more with the extremities and dealing with those ailments.
Okay, so you would be talking about sports medicine. That would be shoulders, knees.
Hips, knees, yes.
Okay.
And even ankles. Sports medicine is a broad topic.
Mm-hmm.
It really refers to treating a high performance athlete.
What's the majority of what's your, like, what do you majority excuse me. What do you normally specialize in? What's the bulk of your cases?
My practice is, a shoulder, hip, and knee practice.
Okay.
So people come in and complain about shoulder pain, hip pain, knee pain, and then it's my job to figure out, how that pain fits into the different treatment options. So, and those treatment options can be, operative or non-operative.
Okay.
The best thing about an orthopedic surgeon is he can do both. He can do non-operative treatment and specialize in treating it surgically.
That's great.
So there are, because there's a lot of people out there, a lot of physicians who do sports medicine, but they're not operative. A lot of them are non-operative and they call themselves specialists in orthopedic care in a non-operative way. To me, I do 70% of my work is non-operative orthopedics.
I see.
Yeah.
I see. That's interesting. So what types of treatments? You say there are non-operative ones and then there are operative ones. How would you describe the non-operative ones first? Because obviously you want to go conservative first, right?
Sure. Well, because you can't go back, right?
Correct.
Once you operate, it's not like I can go back in there and undo what a surgeon does. It's like building a house, once, that's why when you're building your own house, you go over the plans many times with your contractor, you make all the changes, but once that hammer and nail and everything goes through, it's going to cost you a pretty penny to change that, that house before it's changed on the plans.
That makes sense.
Yeah. So non-operative treatment usually starts off with, if something painful. No one's going to go see a orthopedic surgeon or a doctor for that matter unless something's hurt or they don't feel well for something. So, for example, let's take the knee. People come in and see me for knee pain, and then I have to determine what that knee pain's about. We take X-rays. We use an MRI if we need to, a CAT scan to give us more, specialty bony looks, and then I have to figure out my diagnosis, whether it's an ACL tear, for example, or is it arthritis? Is it a meniscal tear? These are the common conditions that people often hear about, and then we put a treatment plan together, and it could be in the beginning just feel that it could be pain meds or a medication that reduces inflammation. This is where, we can be creative a little bit. You can use supplements. You can use other modalities of treatment, whether it could be therapy or massage therapy, acupuncture, for different things. And you have to tailor make that. And once those non-operative treatments fail, then we consider surgery. So I mentioned ACL. If an ACL reconstruction is needed, let's say if someone comes in who's young and has torn his ACL, non-operative treatment is probably not the best answer. We need to do surgery to be able to stabilize that knee so that they can, go back to sports or their activity. But let's say if someone comes in for arthritis of the knee, that's a little bit different. Once you've given them the supplements and the medications and maybe injections of steroid or lubricating injections. And now in my practice, I'm actually doing stem cells. We do a very highly specialized stem cell treatment that can sometimes preclude surgery. So some patients do so well that they cancel their knee and hip replacements.
That's amazing.
Yeah,
that is amazing and so interesting to me because I know that stem cell surgery is fairly new. It's a new practice.
Well, it's been around, but it's getting more and more publicity and research behind it, and it's getting better and better results. When I was in my fellowship at Johns Hopkins and my hospital there, we did a lot of research in that area to rebuild, because stem cells have the ability to differentiate and recreate and rebuild something in the body that's maybe wrong. But, just like anything, it can't be a fad. It has to be proven. It has to go through its process. And I think more and more treatments are coming out where they've gone through that test of time a little bit.
Oh, good. So where would you say we are with that now?
I think in some areas we're actually pretty good for certain tendon injuries.
Like where exactly?
Like, for example, if you have tennis elbow or, golfer's elbow.
Yeah, that's really common.
It's a tendon problem, a soft tissue problem. We've noticed that stem cell or soft tissue, injections like that, it can actually heal the tendon that's torn or partially torn.
That's amazing.
But yet we're pushing the limits to that. And like I said, it's still becoming more refined, and we still have to fit in within the FDA regulations that we can't do certain things in the United States because of our regulatory process. But that's led to some patients going elsewhere and seeking that treatment, whether it's Europe or overseas, in the Bahamas or South America or something like that. But I think we're seeing more and more people try it, so it's getting a little bit more
popular.
Yeah,
that's great.
I personally have had good results with it. So in the time that I've learned to do it.
My question to you, because I don't know much about it, so my question is stem cell. For me, it sounds like it's something that's operative. Is stem cell treatment or therapy something that's operative, or is that something that's non-operative?
It's actually non-operative because
that's amazing.
Yeah, we're actually not, cutting or opening and making big incisions to treat the knee, hip, or shoulder or whatever we're treating with the stem cells. Now, certain parts of stem cell treatment could be operative where you have to do that, but the ones that are being very popular are more non-operative. So,
how does it work?
Well, it really depends on what you're trying to do. If you're doing let's say a fat, stem cell harvest, you would do basically liposuction, through small incisions, and concentrate
Liposuction.
that fat and make it streamlined so that it could actually cause your joints and things to heal and cause less
Regenerate.
pain. Regenerative. It's part of regenerative medicine.
That's
I'm
awesome.
being very basic here, but
Yeah, I'm sure it gets a lot more complicated than
that's
what
the
it
idea,
is.
so to
But when I
speak.
think about it in my mind, I think, okay, you cut the person open, and then you put the stem cell in there, and then it'll go to work after you.
Well, there are some orthopedic procedures where we have to actually do that. And,
Okay.
we've done that as well, cartilage replacement techniques and things like that.
Okay.
But the more popular ones that you're seeing now, they come processed, a lot of the stem cells or amniotic cells, and you're injecting them in areas where you want tissue to regenerate.
And the stem cells have to come from a sample of the person that you're using them on, right?
Well, that's the auto harvest, meaning that you get it from that person.
Okay.
And I'm trained in both techniques, and you can get it, through that person, or there are some techniques where you actually get it from a placenta or amniotic cells.
Wow.
That are allografts. So it really depends on.
Pretty amazing. And did you find that between the two different types of ways to handle it, would you say that the success rates are equal?
Well, that's where it gets a little bit confusing. I
Okay.
think there's not enough research to say that one's better than the other.
Okay.
And that's where people, often, have to go with the practitioner's judgment and what his or her results are and what protocols they use.
Yeah.
So that becomes a little bit
More like a one-on-one.
Yeah.
It's like you were mentioning before, you have to tailor.
But it is something that's more personalized treatment. So, because part of it is that it's not covered by insurance. So, there is a cost to it, and you want to be very responsible in doing that because, you want to take care of your patients in a very, efficient and economic way as well.
Right, of course.
It's tough to just say, this costs $5,000, and if it doesn't work, that person's not going to be very happy.
Yeah.
So you have to be, nothing in medicine is guaranteed, first of all, but we got to do your best to make sure that you're.
I do appreciate that.
Yeah.
And then also, I know that you are on staff at West Boca.
Yeah, it's actually one of the tenant hospitals in West Boca. I've been on staff there for about 7-8 years now, and really enjoyed being there. They do a lot of community outreach like this, and
Yes.
we appreciate that as physicians, and I'm sure the community does too.
Yes, of course we do. And also, I know that they are fully equipped to do the stem cell, right?
Well,
How does that work? 'Cause
the hospital itself is not. This is it's a procedure through the office.
Oh, okay, okay.
But what the hospital is well equipped to is that it's got the latest and greatest technology and robotics and things like
Right.
that.
Robotics.
When we do have to go for operative things, you want to have the tools that are the best.
course.
And they have a Makoplasty robot that offers robotic partial and total knee replacements now. So that's when non-operative things have failed, and now you need to go and maybe operate to replace the part of the knee or the whole knee where it's causing pain.
That's really interesting and amazing. So I'm sure you have to keep up with a lot of education, like changing education for all of these rather new procedures, right?
Yeah, and I think it's common in our field. I mean, we're driven by the fact that we want to be, good doctors and great doctors, and be technically good. In order to do that, you have to constantly, be on top of all the literature and the procedures that are coming out. Maybe I'm not the best at academically the reading part all the time, but I do a good job of keeping up with what I think my patients need.
That's amazing.
Yeah.
That's great. Yeah, it's probably really difficult to balance having a practice, being on staff at West Boca, and also trying to keep up with everything that's changing all the time.
Yeah, it's but people have different skill sets, and once you kind of love what you do, and that's the key to it, I think.
Right.
And I'm always driven to be the best that I can be in the field and that I'm in, and partly because I was pretty competitive, sports player myself. So
What kind of sports?
Oh, basketball, tennis.
What position did you play in basketball?
I was the point guard.
Oh,
the
wow.
leader.
A good ball handler. That's great.
But
That's great.
that was a while back, and
Yeah.
try to stay with it. And now it's just so competitive. But it's that drive to be part of a team, to be good, and to excel that translates into a field like orthopedics, where you can be around sports and
Right.
take care of a lot of athletes in college and professional sports as well. And that's why I went into sports medicine as a background. And as a matter of fact, I was on staff as a Baltimore Ravens doctor, and
Wow.
that was great.
That's
And,
incredible.
Yeah.
Tell me about that. When was this?
This was in my fellowship at Memorial
So
Hospital.
you were young.
I was
really
younger,
young.
yeah,
Really
yeah,
young.
not really young,
Not
but,
really young. Pretty young, I'm sure.
I was in
Pretty
my
young.
mid-30s.
Okay, that's young. That's good.
young,
That's great.
But
So I'm sure you had a good time.
it was great. Being on the sideline for a professional football game was definitely very interesting. I still remember the team. It was the Ravens against the Colts.
Okay.
It was a Sunday night game at 8:00. And ESPN, was there, NBC, and the whole thing.
How exciting.
And it was deafening how loud the stadium was.
I'm sure.
I mean, I couldn't even. You're pretty close to me now, and I couldn't hear you.
Right.
It was that bad. But it was just an atmosphere that I enjoyed, and I knew I was in the right field. That I picked something that I was gonna.
That's great. I'm
enjoy.
sure that was really exciting and like really rewarding for you.
Yeah, personally, it was rewarding.
Mm-hmm.
But when I've come back to the area now. And what's more rewarding is that I'm a community doctor.
Mm-hmm.
I came back to the area that I played sports in, that I played and went to school in.
Right.
I'm
You're
a
giving
team,
back to your own community.
Yeah, and I'm a team doctor for my Coral Springs High School, where I graduated from. My varsity letter, my trophies are still on the wall.
Shout out to Coral Springs High.
Yeah, Coral Springs High Colts. They're gonna have a pretty good team this year,
Yeah.
I think. And then I'm, on staff and take care of the Deerfield High guys too. So shout out to Deerfield.
My son goes to Monarch High.
Yeah, and we take care of Monarch baseball.
you
Yeah,
really?
yeah. So we've done some.
If only he was an athlete. He's a musician.
But you know what? As I was going back, that rewarding part was when my principal walked in and needed my services. from high
Oh,
school.
that's amazing.
My trigonometry teacher.
So
and-
you treated one of your own teachers
Yes.
way after the fact that you were
Yes.
there.
And,
That is incredible.
To be able to give back in that sense was truly rewarding.
I'm sure.
As a matter of fact, I just went to my one of my favorite teachers, a mentor of mine from high school. His name was Captain Bob Clampett. We call him Captain Bob. 70th birthday, and I was invited to his birthday party.
that's so
and
sweet.
He's been a patient of mine too, and
Hi,
I've taken
Captain
care of his family. Yes, shout out to Captain Bob. He's a fisherman, so we've got a fishing expedition we're planning soon. So
That's
you
great.
know.
Do you know when you're going to go or what you're going to do?
I don't know. I'm not much of a fisherman.
No?
But I like going out on the boat. So,
Yeah.
that's going to be the.
I
but
like,
it was
I like
just
going
rewarding.
out on the boat too, Dr. Gupta.
Yeah, I see you got a good tan. So,
That was the 4th of July weekend.
But
It
I
was
have my
also my
natural
birthday.
tan, so-
Yes, I know. I'm jealous of that. I have to work on mine.
4th of July, how was it for you?
It was great. It was my birthday.
Got it. Oh, so
Yeah.
you're an Independence Day.
I'm
baby.
an Independence Day baby. Yep. Been doing fireworks every year for my birthday since I was born.
Yeah, did you see that movie Born on the 4th of July?
Yes, with
Tom Cruise.
oh no, maybe that's wrong. Yeah, no,
was way
I'm thinking
before.
something else. Wait, is the lady in the green dress? No,
I don't
born
remember.
on the 4th of July. I don't
Yeah.
remember either. It's all right.
Anyway, belated happy birthday.
Thank you very much. Thank you. So I wanted to discuss with you because I'm not really too clear. What exact services do you offer at your practice? Like,
Well, my practice, is a pretty full service practice. I mean, we have a foot and ankle doctor. We have a hand surgeon joining us soon. We have a pain doctor starting in a week or so.
Okay.
There's myself, as the sports medicine. We have a general practitioner, Dr. Frank Mole.
That's
Who's a
great.
military doctor, great surgeon. We take care of fracture care. So let's say if you get into an accident, you fall or your mom falls, elderly, we do a good job with fracture care, because we're on at the
it's amazing. It
hospitals.
sounds like you have a rather large practice having so many doctors on staff.
Yeah, fairly. I mean, it's growing.
Mm-hmm.
It's like anything. You stay enough in an area, and people get to know you and they trust you. And
of course, and then they refer their family, and
yeah,
it's what I would do if I find a doctor that I
Exactly.
truly enjoy and
Just more-
know he's good.
Exactly, and again, it goes back to coming back to your community. There's a little trust, that you're able to build.
Right.
So we take care of fracture care. We do joint replacements, hip, knee, shoulder.
Okay.
A lot of the advanced sports medicine stuff. We arthroscopy of the hip.
What's a
knee,
thoracoscopy?
shoulder. A thoracoscopy is basically a minimally invasive way to look at the joint inside.
Okay.
Whether it's the hip, knee, shoulder, ankle, wrist, And various people are specialized in different ways, but and you can fix a tear there.
How does that work?
You use a camera through a small incision, and then you put instruments, and you're sort of like playing Star Wars, watching the TV. So,
hey, if that makes you really good, then by all means, please think of Star Wars.
I just,
That's great.
to throw it out there.
That's
like
awesome.
That
We have a lot of Star Wars fans at my job.
So
actually.
am I.
Yeah,
I'm a huge Star Wars and Star Trek.
It's huge. I personally like Star Trek.
Yeah.
Yeah, I used to watch it all the time. I loved it.
Yeah. But anyway, it's something that it's minimally invasive, so people don't have big incisions. We can do a lot of indirect work, and it gives us a bigger picture.
Mm-hmm.
So and there are certain people who are better at it than others, and so sports guys usually are very good at doing a lot of good arthroscopic work. And then replacements. That's where we make incisions, but we can do it through the robot. We can do it through different things, and we do hip and knee and shoulder replacements in the practice, and we use small incisions. We do the more advanced anterior hip replacement. When it's appropriate. Robotic knee replacements, and
that's so incredible.
And even shoulder. And then all the advanced sports cases and stuff. So.
It's amazing what you can do in medicine these days.
Well, it's constantly evolving.
Truly
it's just
amazing.
like we are evolving. So
yeah, it's great.
It's fun.
So how many offices do you have?
We have a couple of offices. One is in Coral Springs.
Your hometown?
My hometown. But I live in Boca now because I've lived and grew up in the west side. I wanted to be a east
Are you
side.
on the east side of Boca now?
Yes, I am.
Good.
And I'm single, so it's like the restaurants and everything.
Yeah, you've got Meisner. You've got it's great. You've got downtown Boca.
Right.
Yeah.
So
it's
it's
good
just
place
fun to
to
be
be
out here. Yeah.
Plus, you can go to Del Rey really quick.
Exactly. Yeah.
Yes, I know all about it.
So that's one of our offices. Then we have a West Boca office. It's right there on the west side of Boca on Glades Road.
Oh, okay. I know it very well, that area. Is it by 441? Or?
Yeah, it's behind the Furniture Gallery, the Macy's Furniture Gallery.
Yes.
It's called Sports and Orthopedic Center. That's the name of the practice.
Sports and Orthopedic Center.
Yep.
Very good.
You can call us. Our numbers are 561-314-7200.
And that's for your Boca office.
Yeah, we have a Broward number. It's 954-481-9942. And then if you want to,
and people can
website,
just come and they can just call and make an appointment. They don't need a referral most of the time, right?
No, it really depends on your insurance, but yeah, most of the time, no. And we're very good about getting people in. So it's not like you have to wait months to get an appointment with me or, my partners.
Which is something that happens a lot.
Yeah.
Actually. So that's really good to know.
Very, very good in servicing our patients and our community.
That's great.
We do a lot of community outreach events. We
like what? What was your last one?
Well, we did something with the with our our high schools, where we sponsored their where there was band practice and things like that.
That's great.
We did a walkathon, and we're always trying to partner with the community. It's just a way to be involved.
Yeah, and give back.
To me, it's important.
Of course.
To be part of the community in a way that so you build trust.
It's kind of like being part of a team.
Yeah.
Team
player.
back to
yes,
that.
Absolutely,
Yeah.
Yes.
I did a lot of sports growing up, and I have to say now in my adult life that being on a sports team, whatever it was at the time, was the best time of my life.
Yes.
It was the best time of my life, and I learned so much that kind of carries over to off the court.
Absolutely. I mean, I remember. I wanted to be a tennis player at one point.
Okay.
But tennis is so competitive, and I ended up going to University of Florida, which was ranked in the nation. And I know I was a pretty good player. I wasn't a great player like that. So, but
we're glad you became a doctor.
So we chose that route. But community sports like playing intramurals, and we organize teams. And
do you play on any teams now?
Not now. I just don't. My schedule is so erratic a little bit.
Yeah, I'm sure.
But, I'd like if I can get a workout and just get on the weekend, sometimes it's good enough. But but
it's
yeah,
always fun.
It was a lot of fun to be part of a team and going. Even though it didn't mean like a national championship.
Of course not. But it was just good to be there and contribute. Yeah, I get it. Last year, actually, I was in a league in Boca for softball.
Oh yeah.
So
how'd you do?
I did pretty well, I think, when I played.
That's good. Is that something you did through high school? Or?
I did. I played a lot of sports in high school. I played soccer. I played basketball. I did swim team.
That's great.
Yeah.
Part of the most rewarding part about what I do in my practice is that being able to be a mentor to a lot of the kids that are
The
playing
young
sports.
athletes.
Yeah.
Yeah.
And that's really why I chose my field. It was more so that I could be active, stay young myself, be innovative, but be around younger, folks and, who are competitive. And, if they get hurt, they just don't
You know
talk to
what
you
to
about, what's hurting them. They
Yeah.
sometimes open up to you about other things. And to be a mentor and be involved in that
Yeah.
way was pretty exciting. So
I'm sure.
Yeah.
I'm sure that's great.
and that's why I'm a team physician at a lot of the local high schools and, in my area. And,
Yeah.
And, we have trainers in our practice. We have physical therapists that we constantly are always.
What's a word of advice you would give to young athletes in regards to if they get injured or?
It's a good question. It's a really good question, actually. And, the most important thing that I always tell my athletes is that, look, you have a long way to go.
Let's fix this now.
And,
Yeah.
well, not about just fixing it, but be preventative. If something does bother you, let it be known and, get
Right.
it checked out early. And really cross-train. I tell my athletes not to just
Do the same thing.
over and over. Like if you're a baseball player, don't play baseball year-round. Figure out a way to, get some rest away from baseball. It'll help you mentally and it'll help you physically.
Right. I imagine because it's using different areas of the body
Yes.
for different sports.
And then certain areas that get used a lot, get some rest and allow for them to heal.
Yeah.
So I advise that to my parents as well.
Yeah.
Don't push your kids beyond a certain point.
There's a lot of things that I wish, I had someone like yourself telling me, like if I hurt my knee or because I feel it now as an adult, and maybe it could have been avoided.
Possibly. Certainly, you can make the case for it, but I think you would have less injuries. I see too many good players who could have good careers, go and burn out early,
Right.
just because of different things. And and then the other thing is just be well balanced. There's
Yeah.
no reason to think, just because you're very good at something, you're going to make it all the way to college and the NFL. Take it one step at a time.
Yeah.
Balance your life, and if you stay focused that way, you'll have a better
important.
chance.
I agree
So,
with you.
yeah,
I mean,
that's the
now
advice.
I
So-
agree with you. I think my parents tried to tell me that when I was younger, but, now I know.
There you go. It's never too late to start.
Yeah, it's never too late. That's good to know. So you have an office in Coral Springs.
Yes.
You have an office in West Boca.
Yes.
And when are you where?
Well, my schedule is pretty much set. Like on Mondays, I'm in Coral Springs.
Okay.
Tuesdays, I'm in Boca. And then, Wednesday and Thursdays, I'm either in surgery or one of my offices. And then Friday, I'm always in Boca. So
Where do the majority of your surgeries take place?
West Boca is a good place I like to operate. I do operate and have privileges at Boca Regional Hospital.
Oh, okay.
And, the North Broward Hospital. So
Oh, great.
It kind of gives me a good, diverse ground to cover. And just because I know the areas pretty well, too.
Have you ever done a show? Have you ever done a radio show?
Actually, I told you I had one of my own. At
You
one
did?
Time. Yeah, it was called. It was a sort of a sports talk show. We were doing different things about athletics and prevention of injuries and.
That
So-
must have been fun.
Yeah, I was a journalist when I was in high school. So.
Wow.
So I like being.
You do all this
Yeah.
stuff.
So my dad made me go to the debate team.
What was that like?
So it was great. I mean, just people think I'm just I played sports, but I was.
A journalist. You
debate,
played-
and student government.
That's
So,
great. So you're
it's
well-rounded. And that's what you mean about balance.
balance. Yeah,
It's really important.
I just didn't. And there's maybe advantages, disadvantages. People could say, well, if you were just focused in one, maybe you could have. I don't know. Just, but I think balance is good.
It depends on the person, I suppose. I suppose it depends
Yeah,
on
sure.
the person.
Absolutely.
So let's say somebody has knee surgery, right? Because they need to fix their ACL, right? Because that's really common.
Yes. Okay.
How long is a recovery on something like that? When can they get back to their life?
Well, it depends on what part of their life they want to get back to. So let's
Okay.
say if they want to go back to sports after an ACL surgery, it could take up to 8 to 10 months.
Right.
You
And
know,
that makes
minimum of
sense.
6.
Yeah.
But if they want to go back to their job or, being able to walk and do things like that, it can be fairly quick, 2 to 4 weeks,
2 to 4 weeks.
You're up and about right away. You
Yeah.
know, it's an outpatient surgery. I mean, you go home the same day. We get your pain controlled, your wound to healed, and then you start therapy with some restrictions. You're not allowed to play certain sort of sports. You're not,
Okay.
so you graduate your way up. So,
Okay.
and then that's the thing. So,
All right. Well, I do appreciate you coming to interview with me today.
Hey,
I do
I enjoyed
appreciate
it.
you taking the time out. Yes, of course.
Yes.
Dr. Manish Gupta in orthopedic surgery. When we come back, we'll have a second guest for you, Lou from All County Health. Stay tuned.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome to You and Your Doctor, Living Longer and Healthier, sponsored by All County Healthcare, a Medicare certified agency. You can listen to us on 95.3 FM and 1470 AM, and we are live streamed on All County Healthcare's Facebook page. It will be repeated next Tuesday at 11 a.m. and 3 p.m. If you have any healthcare questions, please call 954-717-7027. Ask to speak to Maddie, and she will be happy to answer any of your healthcare questions. Today, for the second half of our show, we have Lou Biasi with All County Healthcare. Welcome, Lou.
Melissa, thank you for having me. And I got to tell people out there that, what is home health? What is healthcare basically, and what do they ask about? We're going to talk about home health tonight. Home health primarily is offered to anyone and everyone, whether they're on Medicare or not Medicare. There's two types of home health, basically. There's respite custodial care and there's skilled. If a person needs 2 hours worth of care or 4 hours worth of care, that's available for them.
Okay.
That's available through, in Palm Beach County, it's available through a company called American Staffing. And in Broward, companies called All County Staffing, where they provide respite and custodial care. Meaning, right?
Say that slowly for me, Lou.
Okay, I'll slow it down. What I'm talking about is respite and custodial care. There's a lot of people out there, their families are taking care of them, but they need some time off. And they say, well, what am I going to do? Who can I call? Where can I go? And that's how I really got into the business, because my dad got sick many, many years ago, and my mom was taking care of him. She couldn't do that anymore. And I had nowhere to go except I talked to, a social worker at May Volin.
Okay.
And she says, if you call this company, they can provide a home health aid. And so I didn't even know what a home health aid was. So I called the company, and in comes this lovely young lady who took care of my dad. He had dementia, by the way. and she took care of her dad. And my mother was a little apprehensive about having anyone in the house, like most people are. So that next day, I says, "Mom, you want me to change the A?" She says, "Mind your own business." Right? So she really fell in love with the A. The A became part of the family.
Oh, that's
Became
nice.
such part of the family that he got 24-hour care. And I can tell you, it really, really relieved me of a lot of pressure.
I'm sure.
See, it relieves the family of a lot of pressure. So there's two choices. We either put them into a facility, which there are some great facilities, and the question is the cost, right? Could they afford a facility for X amount of dollars? Or we provided, he basically stayed at home where he was more comfortable. He was, he's very, where you're accustomed to where you're doing, you know where the bathroom is, you know where everything is.
Of course.
And he had my mother there for companionship. And plus the aide provided companionship for both of them, which was a great thing. So right after I saw that, I ended up buying, real interested. So I said, let me get into this field. So I got into the field, and when we were in the field for like 20, 25 years. And we developed from the private sector, which we built a tremendous practice up, we ended into what we call a Medicare home care agency, a certified Medicare home care agency.
Okay.
That means you have to go through a certain process to get Medicare certified, to get a Medicare provider number, so you could do the skilled care. Now, people out there listening, you're entitled to Medicare home care if you're on home care, if you're on skilled care or Medicare Part A, Medicare Part B, or if you're even on a Medicare Advantage plan, right? You're entitled to skilled care. People on Medicare Advantage don't realize the difference between Medicare Advantage and straight Medicare. And you understand, I'm very pro-straight Medicare.
Okay.
I'm not saying
Tell me
Medicare,
why.
I'm not saying Medicare.
I don't know. I don't know much about it.
Medicare Advantage is bad. Well, Medicare Advantage is primarily run by the private sector, private industry.
Okay.
Those are the Humanas of the world. Those are the AvMeds of the world. What they do is they take a sum of money from the government to manage your health care. Right?
Okay.
Remember, they take a sum of money to manage your health care. Being a private company with shareholders, they want to show a profit.
I see.
So at one time, they were spending maybe 40, 60 cents in every dollar on medicine, where Medicare, straight Medicare, spends almost 90 to 99 cents on straight medicine. So, that, if you're on Medicare Advantage plans, which a lot of home care agencies frown upon, you got to get authorization for almost anything and everything you do.
Okay.
But you don't get paid. Medicare, if they're accepted because they run a MECA number to make sure they're on Medicare. Once they're accepted to Medicare in home care, they get 60 days worth of service. And that could be very simple, from nursing care to physical therapy to occupational therapy to pulmonary function disease.
So you're pro straight Medicare because they make healthcare accessible readily.
Well,
Is that why?
Absolutely.
Okay.
That's a good question. Very good question, Ilsa.
Thank you.
The difference is, if you're straight Medicare, you can go anywhere in the country to any hospital you want.
Okay, that makes sense.
If you're on anything with a Medicare Advantage plan, you have to make sure that facility takes your plan.
So it's kind of like having an HMO and a PPO.
Well, that's what basically that's what it is. It's an HMO, PPO. And people say, well, let me tell you, it's a great marketing tool they use, because they say Medicare Advantage. Well, I got an advantage over straight Medicare?
Right.
Well, don't believe that terminology.
We don't think so, folks.
Because there's not that much advantage if you go in an Advantage plan versus Medicare. There's probably much more advantage being straight Medicare, right?
Right.
So, once you get accepted, there's a 60-day episode.
Okay.
You send a nurse out that does a home assessment. And then they bring in they'll recommend it. They think you're going to need PT. They'll recommend to your doctor you might need some physical therapy or occupational therapy. They do a complete assessment, a 16-page assessment. Takes about an hour and a half to go through the whole assessment to determine your needs and your likes and your dislikes. And we work in conjunction with the doctor. See, work in conjunction with a plan of care that your doctor has to authorize and provide.
Okay.
So once we do that, we know that we're working with your doctor. And if there are any changes in that, we notify your doctor. Now, one of the biggest problems today facing our society today, especially down in Florida, is COPD, is respiratory disorders.
Yes.
Excuse me, I was just discussing that.
Okay.
And a lot of people come down with pneumonia and they come down with COPD. And we just did a study. We were at a meeting yesterday. We found out the billions of dollars that the state of Florida spends on COPD. I said billions, not millions. So there's
Wow.
billions of dollars are spent, and there's no cure for COPD.
What is COPD exactly?
It's a respiratory basic disorder. COPD is, it's hard for people to breathe. It's like that commercial when the fella sees the elephant sitting on his chest.
Yeah.
It's very hard for him to breathe and get his breathing levels. He's using on oxygen. He's on a nebulizer or something.
Oh.
All County Healthcare 5 years ago got involved with a program called IPV,
Okay.
which is interpulmonary respiratory function. We work with the patient. And what it is, in the hospital, when you go in for COPD, they'll work with you with this pulmonary team where it'll help and increase your oxygen levels. But when you come out of the hospital, we're the only company, remember, we're the only company that can provide a unit that has a continuation of that type of care. It's called IPV, interpulmonary ventilation. And what they do is they basically work with the patient and they help the patient breathe through this unit because the patient can't get the mucus up.
Okay.
And this machine helps them relieve that mucus and brings their oxygen levels. I tell a funny story.
And you're the only company?
We're the only one because the owner of the company was smart enough that when they bought the units, no one wanted to buy them because they're not reimbursed for the units. All County does not get reimbursed for the units, it's an expense item, but it helps the patient tremendously. So we were working with the company to provide the units. We ended up buying 5 of them. They're $16,000 each.
How much?
$16,000.
$16,000 each unit.
Right. And
That's
we don't
amazing.
get paid for that unit. We get paid for the nursing. And every mouthpiece that a patient gets to breathe into that unit with a nebulizer costs the company $100, right? So All County is like concierge medicine saying, hey, we're going to give you the best of care. We're going to get the best of outcomes. Mm-hmm. And we've done that. We've done that through the years, from our private sector all the way up to our Medicare skilled sector. We pride ourselves on concierge service. And if people don't get what they want, they can call Maddie, they can call me, they call the company, and we look into it right away. And then let me tell you, the team we have is fantastic. Our nursing team, our respiratory team, our physical therapy team, speech team, everything we got is top shelf. And if it's not top shelf, you call us and we'll make it top shelf. For instance, sometimes a patient really can't get along with a nurse, right?
I'm sure
Call
that
us,
happens.
we change it, right? Or they can't get along with a home health aide. Call us, we'll change it. All County gives you what you need. We probably have more home health aides in with patients than any other company. And when we say about what's happening with COPD, which we're really looking to specialize in now because it's such a cost factor to the state into our whole healthcare system. I mean, if you're looking at spending billions in Florida, multiply that by all the states, right? And we have a whole shot that ACA, that's the controlling agency for Florida, that puts out that tells us every admission in every hospital in the state of Florida and their readmission. I was just talking to a young lady, she said, well, that agency says they have a 15% readmission rate every 31 days. I said, gee, you think that's great? Yeah. Well, we have a 0 readmission rate to the hospital in 12 months. So if you think 15% readmission rate in 31 days is great, because Medicare will not pay if you're readmitted within a certain period of time for the same disease.
Amazing.
So the hospitals don't want that readmit.
Right, they want the patients cured.
Right. So if you have COPD or you have any respiratory disorder, call All County Healthcare. Tell your doctor that's where you want to go and try it. At least try it with us. You have nothing to lose. And we'll guarantee that you'll be feeling much, much better within 7 days to 11 days. And we've taken an individual who's on oxygen, living here in Boca, who was on oxygen, and his wife was always looking at that tank. He was 80 years old. We gave him the treatment for 11 days. All of a sudden, it was the middle of summer. He gets off the oxygen, he gets off the treatment, he jumps in the pool, comes home, makes love to his wife at 80, and she says, I want to buy that machine. So guess what?
That's amazing.
The machine works, see?
That's a great story.
And healthcare is available. Medicare healthcare that you're paid for. It started in 1963 with the Social Security Reform Act. They said when you retire, you're going to get health care.
So they can call you directly if they want to.
They can call me directly, call Maddie directly. They can call our office.
Right.
Our office is 954-717-7027. That's 954-717-7027. They can ask for Maddie. They can ask for me. And if we can't answer your question right there, we'll get the answer. Right?
You guys can just call with questions. There's no
call in
commitment to
tonight.
anything. If you have any
just
questions
let
you
us
need
know.
answer, you can call into the show tonight if you want to.
And they can understand that is Medicare at home care is given to them. There's no charge that they come out of pocket with. That's paid for, like their hospitalization, Part A and Part B.
It's a no-brainer.
Which covered under Part A.
Right.
So when people say, well, the doctor's out of home care, well, I don't want it. They probably don't want it because they think they got to pay for it, right?
Yeah.
You don't have to pay for Medicare home care. You might have to pay for respite care if you don't have what they call a long-term care policy. Respite care is covered under the long-term people. Well, people come like, hey, does my Social Security cover long-term care? No. The only insurance that covers long-term care, when I'm talking about respite and custodial care, is long-term care insurance. And I think you should, and I tell everybody, if they're young, they're middle-aged, invest in it now. Because it protects your assets down the road. Because if you want to go into a facility, you have to, and you don't know what age you're going to get hurt or sick.
It's true.
No one knows that.
Yeah.
I mean, we've taken care of a championship hockey player. They won the Stanley Cup. They went out. They got in an accident. He's quadriplegic for life.
Oh, man.
Right?
That's
So
terrible.
he needs around-the-clock care.
Yeah.
You don't know when you're going to get in an automobile accident, a motorcycle accident, or what age. Medicare covers you from the 65 and over. You're entitled to Medicare.
Right.
And that comes out of your Social Security. Medicare also covers you if you're totally disabled.
Okay.
In a car accident, you can't take care of yourself. So, that's what I say. Medicare, Part A, Part B. With a supplemental, you go anywhere you want to go. So when somebody's trying to sell you something, like a salesman saying, Medicare Advantage will give you this, this, and this. Remember, why would you want to be on something that's government paid for? You paid for it all your life, supplied by the government, right? Versus something that's supplied for somebody that's for profit, right? He has to make a profit. For them to make a profit, they basically, where are they going to cut costs? We have to cut somewhere.
Right.
And, and people say, well, I don't like this and I don't like that. They didn't like Obamacare. Well, Obamacare helped them have their children stay on to the 26. Prior to Obamacare, insurance companies didn't have to take you if you had a pre-existing disease.
Right.
Now, that's all the fight right now between what's happening on the health care bill, which they don't have. We don't know what's happening with health care. They don't, and everybody's fighting. They want to keep pre-existing in there. Insurance companies want to get it out of there because that's where they're going to spend some money. If a person had pre-existing, if you're a young lady and you had any kind of breast disorders or any problem with your breast or any kind of disease, and you were, say, a mother and you want to go on health insurance, you couldn't buy it.
Yeah.
Unless you went to work for a company and got group insurance. If you got group, they have to take you under a group policy, insurance companies.
Right.
But if you're an individual, they don't have to. Now they can't refuse you.
Right. Now they can't hold your pre-existing against you.
They can't hold your pre-existing against you. You can't hold anything against you. They can charge you a higher rate, right? They determine what the rate is. That's why they keep saying, well, my insurance rates are skyrocketing. Well, yeah, because you know why? Obamacare forced them to spend 80 cents on every dollar on medicine, or they give you a rebate.
I thought it was based on your income.
Well, Obamacare is based on your income.
Right.
But what it basically did is Obamacare said to these insurance companies, you're making too much of a profit on medicine. You have to spend 80 cents of your dollars you collect on medicine. If you don't spend 80 cents of your dollars on medicine, we want you to rebate that difference to the policyholders. So they're pretty upset if their profit margins are cut.
I'm sure.
Right? So if they were cut from then that's why they keep raising those rates, raising those dollars rates. People say, well, they raised the rates because of what? They're getting out of this because of what? Well, there's an old saying. If you're selling in the state of Florida, see, the insurance commission of the state of Florida determines who's coming in the state.
Okay.
They determine what car insurance is going to sell, which homeowners insurance is going to sell. And people say to myself, and you guys out there that are young might not like this. What has happened for years, there was a certain percentage of elderly people on Medicare.
Okay.
That level since 1963 has grown. The age level has grown tremendously. The largest amount of population, the largest segment of population is centurions, meaning people 100 longer is the largest percentage growing. So people are living a lot longer than 60 or 55 or 85. They're living into the hundreds. So as that increases grows, you expect the younger people to take insurance. Well, the younger millenniums are not buying insurance because say, I don't need it, I'm sick, I'm not sick. And in this country, you can't be turned down. What do? You walk into the emergency room.
Right.
And if you don't pay the bill, that means we pay it as taxpayers.
Yeah.
So somebody says, well, how do you stop that? What are you going to do? Well, they try to tax you. They try to say, okay, we'll penalize your taxes, right? Take it out of your taxes.
Uh-huh.
Well, they don't pay that much in taxes, some of them, because there are a lot of waiters and, people that are they don't claim all their income.
Right.
So the tax level is low. I say, you want the young people to pay? Guess what? You can't get a driver's license unless you have health care insurance. Right? You can't buy a house unless you have health care insurance. Why? Banks force you to put homeowners insurance on your home.
Yes, they do.
A bank will force you to put auto insurance on your car.
It's true.
The state tells you got to carry PIP, right?
Right.
You've got to carry so much insurance.
At the very least.
Right. So the answer is very simple. If you buy a car, your chance of getting an accident, you have no insurance, who's going to pay for it? Right? So you'll see how fast they'll buy the insurance. They'll spend $4,000 or $5,000 for car insurance, but they might not spend a couple $100 for health care insurance. Right? So I know it's a terrible thing to say, but you got to get the millenniums and the younger people into buying their own home health care. Listen, you can be on your family plan until you're 26. After 26, if you're away from your family, away from school, guess what? We got to grow up. We got to start taking some responsibility.
Yeah.
Right? You can't depend everything upon the seniors. Right?
Right.
The seniors are growing longer. They earn their keep. Now it's up to the younger generation to help pay for some of the bills. Right? So that's why healthcare is, we don't know where healthcare is going in the future. Our country doesn't know where it's going. Our politicians don't know where it's going. They're coming back now. I guess the Congress is coming back this week to try to resolve a healthcare problem. We don't know where Medicare is going. We don't know where managed care is going. We know hospitals will always be there. We know sickness will always be there.
Yeah.
So, people are concerned.
Yeah.
They're concerned about where am I going to get my health care? How am I going to afford health care?
How would they get their home health care?
Well, home health, they can get that, as I said. Home health is two ways. It's given to them once they reach 65, right?
Through straight Medicare.
Through straight Medicare.
Okay.
If you're on a PPO or you're on a Medicare Advantage plan, in their policy, they're still entitled to some home health care. If their policy is written where they're allowed to get it. Review your policy. Examine your policy. Find out what you're entitled in that policy. And your supplemental policy, read them. Find out. Matter of fact, we had a gentleman on the show who's an expert in that. It's Sandy Jacobson. He'll be on again. Sandy, if you want to call Sandy, he's available too. Just call Maddie. Maddie will give you Sandy's number. He'll advise you primarily what's the best bet for you when you're ready to turn 65. We're talking about 65 and older.
And what age group is already having this conversation with
Healthcare?
your friend and with you? Like, when should somebody start thinking about this stuff? Because I'm sure you don't want to wait till the last minute.
Well, I play a lot of golf. I used to play a lot of golf before my knees. And every guy that's turning 65, Lou, what should I do? Lou, what should I do, right? And I say, listen, I'll tell Sandy, come and see you. Stay in straight Medicare and buy a supplemental. Well, those that some do, and some realize, I get it cheaper, get this cheaper. Listen, you're going to get what you pay for.
It's true.
Right?
Yeah.
There's people that drive Rolls Royces, and there's people that drive Fords, right? Not saying Ford's a bad car, but it's what do you want? Home health and Medicare Part A and Part B, to me, is the Rolls Royce of healthcare insurance.
Okay.
Right? There's no question. It's the Rolls Royce of healthcare insurance for seniors 65 and older and for those that are disabled. Right? Any other thing is, for instance, if you get sick, we had a lady, she was on Medicare Advantage, she needed a heart Holter monitor.
Okay.
Well, she told me, she said, Mr. Biasi, she says, I ordered my Holter monitor. It's been 12 weeks since I got it. I said, well, you could be dead in 12 weeks, right? Well, if you order the Holter monitor the next day, you get it under Medicare. Okay? See, everything's got to be approved.
Because you're waiting for authorization.
Authorization. You got the word. Who's going to authorize it?
Right.
Doctor's office calls you now, and you go in, and he says, okay, you need authorization. So you got 3 girls trying to get authorization, right? They're not talking to doctors. They're talking to girls just graduated high school or, a junior year of college or college.
Right.
She's got to get authorization, right? Mm-hmm. So now they have to go out and seek somebody else to get authorization, right? They get authorization for how many times a week I can go in there as a nurse.
Right.
They'll say, okay, we'll allow 3 visits. Well, you're going to need more than 3. We'll call back for authorization.
So it's kind of like the runaround.
It's a runaround. You got to keep calling back for authorization, right?
Right.
Now, same thing with time to get paid, right? Well, you use the wrong number, you use the wrong image, you use the wrong code. Sometimes they don't pay you the full amount of money. So doctors now are saying, we don't want to accept that program.
Which is the A and B.
No, they don't want to accept the PPOs or the HMOs.
Oh, right.
There's a lot of doctors say, we don't want to be on that plan anymore. Mm-hmm. We want to be on this. I know there's an orthopedic group here that says if you're not a straight Medicare or PPO, we're not taking no more Medicare Advantage.
There's a lot of doctors like that now. A lot of practices, just because it's so difficult to get paid.
If a doctor's been in, you just had Dr. Gupta on, orthopedic, a very well-known orthopedic surgeon. Mm-hmm. He has to do a number of new knees, a number of new hips, because they cut down payments, right?
Right.
And they can negotiate their contracts that says, okay, this is what we're going to pay you. And if you don't take the contract,
Go ahead.
if you don't take the contract, you say, okay, where am I going to get paid? Mm-hmm. So they'll take whatever they can get along. Some panels, some contracts, they're not even authorizing anybody. People say, well, why don't you take HMO contracts? Because you can't get them, right?
Right.
Because the panels aren't open.
I see.
They'll limit to some, like Humana limits to one group. Mm-hmm. They then job out all those people to somebody else, and it's a big entanglement, right? Mm-hmm. So when you're looking to say, I want home health or I need home health, right, where do you call? Well, my suggestion is call All County Healthcare.
Yeah.
It's the concierge of home health. Mm-hmm. You're going to get concierge service, trust me. I know Maddie. Maddie's here. She's here every week, and I can tell you, she watches her patients like no one else.
That's great. Maddie can be reached at 954-717-7027. If you have any questions in regards to healthcare, please reach out to All County Health. They will answer any of your questions. Thank you so much for joining us tonight. Thank you, Lou, for being a guest tonight.
Thank you for having me.
Our sponsor for the show, Lou with All County Health.
And thanks for being on a number of weeks, and I hope that some of the people got some knowledge from all our doctors.
I hope so, too. Thank you so much. You have a good night.
Thank you. You too.
Signing off, guys. See you next week.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.